Giving a safe handover is one of the most important skills in nursing, and honestly, it's also one of the scariest. Here's how to give a safe and effective nursing handover. Hello, you're on Shift with Sian, the platform that empowers student nurses with the knowledge, the tools and the support to build confidence in practice. We've all been there, standing in front of the team, thinking about giving handover, thinking, please don't forget anything. But don't worry, because in this video, I'm going to break down exactly how to give a clear, confident and safe nursing handover with real examples that you can use on your next shift. And stay to the end because I'll show you where you can get your complete handover pocket pack to take with you on placement and your free SBAR cheat sheet that'll make your next shift much easier. So what is a nursing handover then? So nursing handover or handoff is when you transfer care to another nurse, team or ward. It's your moment to share everything that's important about your patients. So their condition, their care plans, the risks and what still needs doing. It might be during shift change, when a patient moves to another ward or when you're calling a doctor to review somebody. So why safe handover matters then? So handover isn't just a routine, it's a patient safety tool. A clear handover prevents missed information, delayed treatments and even serious events and incidences. When you hand over well, the next team knows exactly what's happening and patients stay safe. Now let's talk about structure, because handovers can get messy without one. The most widely used structure in the UK is the SBAR. So situation, background, assessment or recommendation. It's a simple, clear and recognised everywhere, from wards to emergency calls. SBAR keeps everyone speaking the same language and cuts out the unnecessary waffle. And when you're on shift, trust me, nobody wants a 20-minute monologue when they're running between patients. So SBAR is your friend, it's quick, it's structured and it's safe. You can download my free SBAR prompt to keep on your phone or print it out to pop it in your lanyard on placement or shift. The free download is on my website, shiftwithsian.co.uk, and you go to the free resources tab. I'll also put that link in the description. So what to include in your handover then? So when I was a student, handover used to make me so anxious. I'd start worrying about it halfway through the shift. But the trick is to know what's relevant. So here's your quick checklist for every handover. So patient name, age and reason for admission. Key medical history, so keep it relevant. Current treatment plan and medications. The latest observations and trends, use your News 2 scores. Any tests or pending results, nutrition and mobility status, so are they eating and drinking, are they self-caring, any pressure area care and falls risk, any DNAR, respect or care plans that are currently in place, the social or discharge concerns and any red flags or worries. Stick to what matters. The safer and sharper you are at handover, the faster it's over. So here's what a handover sounds like when you put it all together. So Terry is in bed 1. He's an 80-year-old gentleman admitted yesterday with chest pain. He's got a history of angina and TIA. He's on the ACS pathway. Aspirin, clopidogrel and GTN spray have been prescribed. His News 2 score is 0 and his ECGs were normal. We're waiting for his first troponin result. He's eating and drinking well, is mobile and self-caring at low risk of falls. The plan is to discharge with GTN spray if the tropes come back normal. There's no current issues. That's clear, concise and hits all of those important details. Notice there's no waffle, it's just facts and next steps. So next then, we're going to have a look at how to use the SBAR when you're escalating. For example, you've bleeped the doctor to come and review your patient. What do you say next? Now, unlike a shift change handover, to escalate, you need to be more concise and get straight to the point as to what you want them to do. So here's an example. Hello, my name is Sian. I am part of the nursing team on Bluebird ward. I'm looking after Mrs. Patel. She's 76. She was admitted yesterday with pneumonia on IV antibiotics. She does have a history of COPD and heart failure. Her oxygen saturations have dropped in the last hour from 88 to 84 despite being on oxygen. Please could you review this patient as soon as possible as she's not responding to the antibiotics. So that was short, safe and straight to the point, and that's what every clinician wants to hear when they are so busy. Notice that I didn't give any details about social circumstances, and that was because it wasn't relevant to why I'm asking the doctor to come and review. My top tips then for a confident handover. Now let's be real, confidence comes with practice, but these tips will help massively. So write quick notes before a handover, don't rely on your memory. Speak slowly because nerves make you rush and then you'll forget things. Use a prompt sheet or a SBAR card to stay on track. Be clear and no, you don't use any unnecessary jargon. But push yourself. Offer to hand over 1 or 2 patients at first and then build up to the whole bay. The more you do it, the more natural it feels. And trust me, nobody is judging you. Every nurse remembers their first shaky handover. So here are the most common handover mistakes to avoid. Waffling or giving irrelevant information. So she's got 4 cats and she loves bingo. It's great, but it's not relevant to the handover. Forgetting treatment changes or risk factors. The most important information needs to be given first. Speaking too quietly or rushing, again, you're going to miss information or then it's not going to be heard. Not knowing the current plan. You must make sure that you're up to date with all the most current plans for your patients because you may get questions. So write it down, check with your mentor, and you'll start to build a solid habit really fast. So there you have it, how to do a safe, effective handover made simple. So don't forget to use your SBAR, prepare and keep focus on what really matters, which is patient safety. If you still find handover a little bit daunting, I have created a complete handover pocket pack for you to keep with you on placement. It's designed to make handovers feel less scary and more structured. It includes the handover basics, an SBAR framework, how to do a bedside handover, how to refer your patient to specialised teams, how to request an urgent review for your patient, and how to conquer a 22222 call out, what to say and do in an emergency. This pack is downloadable to carry with you on your phone, or you can print it out to pop it in your lanyard so you have it with you on placement or shift. It's perfect for student nurses, newly qualified nurses, or anybody that needs that extra confidence boost when it comes to handing over. The link for that I will put in the description along with the free SBAR cheat sheet. If you found this helpful, click like and subscribe, and check out my other videos on my clinical skills playlist. Be kind to yourself, we've got this.